Greetings! Welcome to this video where I am going to teach you why your pain problem may not be resolved by stretching. In fact, there's two key reasons why your pain is not being relieved by stretching. My name is Dr. Jeanette DeWitt. I'm a doctor of physical therapy and a chronic pain specialist. And I get this question a lot. Dr. Jeanette, I have been resting and I have been stretching, trying to relieve my pain, but the pain's not going away, and sometimes the stretching makes my pain worse. Well, why is that? Well, there's two key reasons. Number one is that the tissue may not actually need to be stretched. It may not need to be elongated, and I'll tell you why. Every muscle, if we're talking about muscles as the tissues involved, because muscles are what is the tissue that needs to be stretched or doesn't need to be stretched. And let me clarify that. So a muscle is going to be connected to a tendon, which is connected to a bone. So the tendon connects the muscle to the bone, whereas a ligament connects bone to bone. So I just want to share that difference. Ligaments do not contract, so they don't stretch per se, and shorten. They don't elongate and shorten like a muscle does. However, a ligament can restrict movement when it's taut. So think of like an ACL joint. An ACL is the anterior cruciate ligament of the knee joint. When that is under stress, it will become taut, T-A-U-T, so that the bones do not shift in a way that would be detrimental to the knee. When there's too much force placed on the knee, that ligament can tear because it's under too much stress. So that's what happens to a ligament. For a muscle will shorten and it will lengthen. And there is an ideal length-tension relationship for every type of muscle. If this is the normal length of a muscle and you stretch it, it becomes longer. It elongates. If you shorten it to do work, it does a contraction. If a muscle is already in a lengthened position, meaning it's not in its normal resting, it's already in a lengthened position, it does not need to be stretched. It's already elongated. If it's in a shortened position, it's contracted already, or it's tight, or it's impeded by something like a trigger point or a muscle knot. And it's already also not in its optimal length. And what I mean by that, it's too short. So it's not as efficient and it can't do work as efficiently or contract as efficiently because some of the muscle fibers are caught up in this trigger point and you don't have access to all the fibers. If you try to stretch a muscle with trigger points in it, it won't stretch because there is a physical impairment within the muscle fibers. There's something restricting it. So there's your two reasons why it doesn't pay to stretch and you're not getting relief from stretching because either the muscle is already in an elongated position when it shouldn't be, or it's in a shortened position, but there's a trigger point impeding its ability to be stretched or elongated. That is why if you are in pain and you are trying to stretch and it's not working or it's making your symptoms worse, stretching is not the answer to your pain problem. So what is the answer? Let's take the first case scenario. If your muscle is in that elongated position, meaning it's already lengthened, the worst thing that you can do is try and stretch it and elongate it more. That's going to hurt. It doesn't need to be stretched. It actually needs to have its tension restored and go back to its normal position. Now, why does that happen? Well, let's just look at the pelvis. If you have a pelvis and one side of the pelvis is rotated forward, it's going to make your hamstrings in a lengthened position. If you keep stretching your hamstrings, it's going to lengthen them more and it's going to throw you even more into either a pelvic rotation that's already there is going to create some sacroiliac joint dysfunction because you're lengthening a muscle and pulling the pelvis into a different position than it really wants to be. And you're stretching a muscle that's already lengthened. We don't want to do that. We want to restore the length-tension relationship between the front muscles, which would be your hip flexors, and the back muscles, which would be your hamstrings. So if the hamstrings are in a lengthened position and you go to stretch them, it's probably going to make your symptoms worse, because that's not the answer. The answer would be to correct the ilium or the pelvic rotation and put the pelvis back into its normal position. Now you can do that multiple ways. I teach people how to do that themselves because I like people to have those tools. But you can have somebody else move you and put you back into position as well. So you can have either a chiropractor or a physical therapist like myself, or even a massage therapist, depending on what techniques they're doing, can help restore that length tension balance. But you can also use movement to fix that and correct that problem. So that's one example of your hamstrings being in a lengthened position and not needing to be stretched. So if you stretch, it's probably going to make the symptoms worse. Now let's just take a muscle like your neck muscle here. It feels really tight. You've been on the computer. It's shortened. Your shoulders are kind of coming up into your ears. And you've got some trigger points. And let's just say the upper trapezius muscle right along here. Now, if you go to try and side bend your head and stretch, you're going to feel like a pulling sensation. And it might even feel like, oh, I just can't go any farther. The reason you can't go any farther is because even though the muscle is shortened and needs to be stretched, you can't physically stretch that because there are trigger points impeding or restricting the muscle from actually elongating. So it's going to hurt to stretch, or you're going to not even feel a benefit. It's just going to stay feeling tight regardless of all the stretching that you're doing. So in that case, what do you need to do? Well, you need to get rid of the restriction in the muscle so that the stretch can be more effective. And the way you can do that is a few ways. Number one, you can have somebody else move you. That could be maybe the muscle's tight because it's posture. So you fix the posture setting. That's not really movement, you're just fixing your positioning. But you can do that yourself or be taught how to do that, which is what I like to do. The second way is to have somebody move you. Maybe your joint is tight, and so you have a chiropractor or a physical therapist. A chiropractor might adjust the joints, or if they find a subluxation, they might adjust that or manipulate. I might do mobilizations, or I might teach you, which is my preference, how to move to relieve those joint tightness, which could be pulling or causing the muscles to pull into a tight position. But that still doesn't affect the trigger point. So the trigger point, that physical restriction in the muscle, can be relieved through pressure, where you actually do a trigger point release on yourself by using either a golf ball or a tennis ball or a lacrosse ball, and do sustained pressure. And that pressure onto the tissue will help the tissue restriction dissipate and go away. And now the stretching can be much more effective. If you need someone to help you, I do precision neuromuscular therapy, which is medical massage, and I physically go in and intervene and reduce those muscle restrictions. The other way is I teach people how to create symmetry. And this actually helps with both of those key ways why stretching doesn't work. I teach people how to scan their body. We look at upper body, we look at trunk and pelvis, and we look at lower body. And I teach people how to do movements in a full body scan from head to toe. And then we find all the areas that are not in symmetry, and we fix those. When a body is in symmetry and is better aligned, a lot of the restrictions and the tightness go away because the body is already in optimal position. So in that first case scenario where I mentioned that the pelvis is rotated forward, by doing a full body scan, finding out what's not in symmetry, and then fixing that and putting it in symmetry through specific movements, you will correct that pelvic rotation. The second case scenario, so that would be that pelvic rotation with that hamstring in a too long position. The second scenario is where you have a trigger point that's in the muscle, and you can use movement through that too, because when you correct the symmetry and you pump blood flow into the area through movement, that increased blood flow brings warmth into tissue and can help that trigger point relax. It's not always, and the first thing people say, oh, well, I'll just put a hot pack on it. It's not the same thing. A hot pack is an external warmth. Movement creates internal warmth, and it helps free up those muscle fibers at a deeper level. So it's often more effective than just applying a hot pack, even though a hot pack feels good. That's how you use movement to reduce the imbalance or the rotation or the asymmetry, and that's how you use movement to actually help release trigger points. So using movement and learning how to move yourself can help fix both reasons why stretching in its current state may not help. Once your body is in symmetry and things are more aligned, and once those trigger points are released, either through movement or through physical intervention, like medical massage that I do, or you taking and using a golf ball, lacrosse ball, or tennis ball to add pressure to the area and help that tissue release. Once you've done that, the trigger point is gone, and then stretching can be effective. But if you're not symmetrical and you have a bunch of trigger points impeding the ability to stretch, stretching will not work and is therefore ineffective and can actually do more harm and make you feel worse. I hope that this helps. So just to recap, I just want to say 2 reasons why stretching won't work is because your tissues don't need to be stretched. They're already in a lengthened position because they're out of symmetry. Number 2 is you have trigger points within the muscle causing the muscle to be shortened and restricting the muscle from actually being able to stretch. When those 2 problems are solved, either by movement or physically releasing the trigger point, that could be you or that could be a professional, then and only then can stretching be the most effective. I hope this helps, gives you some insight into why stretching may not be working for you. And if that is the case and you have questions about this, please just go ahead and private message me or comment in the feed below. I am happy to reach out to you. You can also visit my website. I'll go ahead and put a link in the comments below, and you can reach out to me that way. That website is www.wellness-track.com, wellness-track.com. And you can kind of look around. You can take that free chronic pain assessment. You can also reach out and schedule a free inquiry session with me so that we have one-on-one time to talk about what's going on with you. But if you've been struggling with chronic pain and you've been trying rest, which isn't working, and you've been trying stretches, which isn't working or making your symptoms worse, please reach out to me because I want to help you because I've got some answers for you. Thanks a lot and enjoy the rest of your day.